My name's Jo Thomson. I'm a GP in Surrey, Sussex even. I'm a GP in Sussex, but I'm the Sussex primary care lead for the Surrey and Sussex Cancer Alliance. I'm joined today by some of my colleagues from the Alliance, including Kat Hodges, who is the Surrey primary care lead for the Alliance, and also from Mark Keith, who is the product specialist lead for Ardens in SystmOne. So I'll carry on just through, just to kind of give you a flavour of why early diagnosis is important. So basically, the NHS long-term plan sets out the ambition, but that by 2028, the proportion of cancers diagnosed at stage 1 and 2 will rise from about 50% as it is now to about 75% of cancer patients. Which will mean that about 55,000 more people each year will survive their cancer for at least 5 years after the diagnosis. And obviously, if cancer is diagnosed at an earlier stage, there's a much greater chance of being able to treat the disease successfully, often with less invasive procedures and fewer long-term side effects. It's also important that we diagnose the cancers as fast as possible so that treatment can start quickly and as accurately as possible as well, targeted to that particular individual. So, for example, identifying that particular genetic makeup. And people that are diagnosed with cancer earlier have a much better quality of life. So not only are they more likely to survive, but they have better experiences of care, treatment, and lower treatment morbidity as well. So that's what we're aiming to achieve. So the PCN DES has been designed essentially to include some of the things that they think that the NHS England feels that really need kind of reviewing, one of which is referral processes and practices of referral for suspected cancer cases to try and improve uptake in cervical and bowel screening, adopt and embed FIT testing for colorectal cancers, and obviously that's part of the IIF as well. And then embedding teledermatology as part of the work that we are doing in primary care to kind of support dermatology referrals, to improve dermatology diagnoses, and to improve the kind of non-malignant and malignant side so that people get through the pathways in a more streamlined way. There's been a big drop-off in prostate cancer diagnoses during the pandemic, and so one of the domains for thanks, Potenza. One of the domains for the DES requirements is the increase in proactive and opportunistic assessments for prostate cancer. Again, that's something that the Alliance are working on currently with Medifer. In parts of Surrey, which is a pilot project, but that's also part of your PCN DES. And then finally, the review of the non-specific symptom pathway where they exist. So that doesn't cover the whole of Surrey and Sussex, but there are pockets of Surrey and Sussex that do have that available. We've done a previous webinar on the detail around the PCN DES for primary care, and that can be found on the Surrey and Sussex Cancer Alliance website. And again, there'll be a link to that at the end. We've also partnered with a lot of different people, so thank you very much to all of our partners who have helped us to develop that website, and also some data packs for primary care to use as part of their kind of benchmarking for PCN DES work, and to be able to get the data for their own areas.